Hey guys, we're here to just go over some reminders of ET tube retaping. So I'm going to just kind of go over a quick little reminder list. It's going to be made available to you. We have to have no distractions during retaping. So no phone use at the bedside, no multitasking, just your complete focus and attention on either holding that tube if you're that RT1 or RT2 that's retaping. Make sure we always have at least 2 licensed personnel, either an RT with an RT or an RT with an RN, doing the retaping procedure. You'll also want to have your nurse assess the patient's RASS score. And so the RASS score is just a tool to measure the patient's agitation or where they are in their sedation. So if they're the higher the RASS score number, the more agitated they are. The lower, all the way down to a -5, is the most sedated. So where we would like it to be prior to moving forward with retaping is less than -3. So if it is greater than a -3, you will definitely want to ask your nurse to sedate your patient. You'll want to also make sure all of your necessary equipment is available before you even start your process. Like before you enter the room, you have your pre-cut tape, your Mastisol, Cavalon, adhesive remover, Tegaderm, scissors, or Anchorfast or Neofit if that's appropriate. If your patient is a difficult airway or critical airway, you will want to have your nurse give a paralytic after a discussion with the doctor if that's appropriate. And just make sure that that conversation happens, that we don't move forward with retaping without that discussion. If a paralytic is given, you'll also want to follow up with a doctor order to temporarily have your settings adjusted to compensate for lack of spontaneous breathing. Okay, the final reminder I'd like to give you guys is just to make sure that you have a standardized way to stabilize your ET tube. Make sure that it's very secure before you get to that point of taking your tape off. So if you're the holder, you're going to want to, there's 3 different ways that we're going to discuss here. So if you have an itty bitty, like a little neonate or a really small infant, with some gauze, after suctioning the mouth and getting all secretions out of the way, hold your tube up against the gum at the placement where you would like it to be. And then the rest of your hand, the 3 fingers that are available there, stabilize at the chin. So then at this point, you'll also want to have your other hand stabilizing the top of the head. So your patient is not freely moving about if they come out of their sedation. And then there's plenty of room there for your second RT to go ahead and tape. Okay, the second holding method is to hold further down the tube, but you're going to also want to make sure you keep your free fingers at the chin as a stabilization point on the face, and your other hand at the head to stabilize. So here we have plenty of room for your RT to tape while you're making sure you look at your landmarks. The third way is if you have a nasally intubated patient. Sorry, little guy. Here we go. So you will want to have your 3 fingers still at the chin as a stabilization point, and holding your tube so that there's plenty of room for your RT to tape, and your free hand holding the head and looking at your landmarks as you move through. And then the final reminder is that you just stay focused during all of these steps, and no multitasking or getting distracted.